All right, nursing students, welcome. We're going to break down a skill that you will use constantly in your clinical practice, and you absolutely need to know it for the NCLEX. We're talking about draining an ostomy pouch. Getting this right is about patient safety, but it's also about dignity. So let's dive right in.
So first things first, what exactly are we talking about here? An ostomy, which you might also hear called a stoma, is a surgical opening. Our job as nurses is to provide the routine care it needs. When we get this right, we're doing more than just a task. We're protecting our patients' health, keeping their skin safe, and, so importantly, respecting their dignity.
Okay, so here's a critical question, one you've got to be able to answer for your exams and in your practice. When do you actually empty the pouch? This isn't just a random guess. There are really clear clinical guidelines we have to follow to keep our patients safe and comfortable. And here is the golden rule, the key takeaway. You want to empty that pouch when it's about 1/3 to 1/2 full. If you wait any longer, think about it. The weight of the bag can actually start to pull the whole appliance away from the skin. And that's a recipe for disaster. Leaks, really painful skin irritation, and way too much pressure on the stoma itself.
Now, before we even walk into the patient's room, we need to get ready. Excellent preparation is what makes a procedure safe and successful. It's all about getting your equipment and your head organized first.
You know, what's really great about this slide is that these aren't just for ostomy care. This is fundamental nursing for every single skill you'll ever do. Checking the client with 2 identifiers, asking about allergies like latex, using standard precautions, and assessing fall risk. These are your universal safety nets. They become second nature.
Okay, next up, let's talk gear. You want to gather all your supplies before you begin. You'll need some non-sterile gloves, a washcloth, a waterproof barrier to protect the patient's clothes and sheets, and a graduated container so you can accurately measure the output for your charting.
And now we get to the main event, the core skill itself. To make this super easy to remember for clinicals and for your exams, we've broken the whole process down into 3 simple, manageable phases. Phase 1 is all about the patient and the setup. I mean, think about it from their side of the bed. You pull the curtain for privacy, you introduce yourself, you explain what you're about to do. All of that helps bring their anxiety down. We help them get comfortable, usually sitting up, and we place that waterproof barrier. This whole process builds trust and gets our workspace ready. Okay, this is the hands-on part. Now here's a pro tip for you. Cuffing the end of the pouch. You just fold it back on itself. It sounds simple, but this little step is a game changer. It makes cleaning the opening so much easier and helps prevent any contamination. Your technique here is everything for preventing skin breakdown and controlling odor. Finishing strong is just as important as starting right. You have to double check, even triple check, that clamp is on there securely. We do not want any leaks. After you've cleaned up and measured, you always, always, always do your final safety checks. Is the call light in reach? Are there personal items close by? Is the bed in the lowest position? Perfect. Okay, so you've done the steps. Great. But being a nurse is way more than just checking off boxes, right? This is where you move beyond the task and really start to use your clinical judgment and assess the whole picture. This slide just lays it out so perfectly. You're basically a detective every time you do this. You're constantly comparing what you expect to see with what you're actually seeing. Is the drainage what it should be? Is the skin around the stoma looking good? Or are you seeing any of these warning signs on the right, like active bleeding or a leaking seal? Those are the red flags you have to report right away. This is so important. This is not just a physical procedure, it can be a really vulnerable moment for your patient. An ostomy can have a huge impact on a person's body image, so use this time to connect. Don't just do the task silently. Ask open-ended questions like, how has this been going for you? Encourage them to participate, even if it's just holding a towel. That gives them back a little bit of control. This is where we care for the whole person, not just the stoma. You've heard it a million times, and you'll hear it a million more. If you didn't chart it, it didn't happen.
Your documentation has to be on point. You need to chart the amount, the color, the consistency of the drainage, and, super important, the condition of that surrounding skin. This is how we communicate the patient's status to the entire healthcare team. So, let's wrap this all up. What are the absolute must-remember points that you need to master this skill for your exams and, even more importantly, for your future patients? Let's do a quick recap. All right, let's lock these in for the NCLEX. Remember, empty when it's 1/3 to 1/2 full. Your safety checks, non-negotiable. That clamp absolutely has to be secure. Always assess the drainage and the skin. Remember the person and address their emotional needs. And finally, document everything. Getting these points down is what makes you a safe, compassionate, and effective nurse. Hey, if you found this guide helpful, do me a huge favor. Hit that like button, subscribe to the channel, and share this with your classmates. And for some more in-depth study guides to really help you ace the NCLEX, be sure to check out the links to our revision books down in the description. Thanks so much for watching, and now